As we went forward over the last year and a half, the last 2 years, we took this out to the public. You had a chance to comment on it as well. But we also asked the Institute of Medicine for their view, again, in the same way that we asked our National Vaccine Advisory Committee, because we recognize we don't do this very often to update this plan, very often, and wanted to make sure that we had a number of views about people thinking of the hundreds of things you could do, which are the things that we think are going to have the most impact. So the Institute of Medicine gave us their view. You'll have a chance, you could look at their document as well. They went into lots of details, but we sort of looked at some of the highlights. Our National Vaccine Advisory Committee gave us their views. There was an internal assessment across the sort of the professional stakeholders in the U.S. government, and as well as the kind of input we had from the stakeholder meetings that we had and the Institute of Medicine had, and input from Federal Register announcements. So I think together I wanted to talk about what the overall priorities are, because when you look at the plan, there are 130 or 150 some odd pieces of the overall program, but wanted to highlight the priorities themselves. So these are the areas that we think collectively that not only are going to have the largest impact, but because we wanted to make sure that we had a plan that was measurable and had some accountability, these are the things that we're going to focus on for the development of the implementation plan. And so I urge you to watch this space. We're in the process now of developing an implementation plan. You'll have a chance to see your opportunities to participate in that, because this is where we're going to set the bar, literally, about what we're trying to achieve. I'll get onto this in a second so you can read a little bit better, but I will say that when we presented this to the Secretary, one of the questions was, what's the goal of the overall plan? And we had discussions throughout this about whether or not a plan should be achievable or whether or not it should be aspirational, recognizing that the latter costs more, for which there weren't necessarily resources that had been dedicated. But it was a clear message from the administration that this should be a plan that's aspirational. Not blue sky, but it should be an opportunity to say what we really think we could achieve and where might we be in 10 years. So we don't have that, and that's the homework assignment now. We're in the process of developing that, and I would encourage you to think about what you think we should be looking at and measuring, and how much of a reach we should have as we develop this plan. So this is the same information, just packaged in a way that's a little bit easier to read. These are the priority, the theme areas for which we're developing an implementation plan, which we'll then be measuring against with an annual review by the National Vaccine Advisory Committee, and maybe an annual review here if this is something that is of interest to this group. So the first is the developing what's called a catalog of priority vaccine targets of domestic and global health importance. I'll talk about that a little bit more because I think that's something that's particularly interesting to this audience. So I'll park that for now because I will get into some more detail. And these go along with the overall goals in the plan. Strengthen the science base for the development and licensure of new vaccines. Again, Marianne Gruber had a chance to tell us some of the things going on at the FDA in that lane, particularly some of the things about the porcine circovirus and the kinds of science that went into that, the discussions of the meninge B vaccine, and how to try to make a regulatory science assessment of a pathway. Enhancing the timely detection and verification of vaccine safety signals and developing a vaccine safety research agenda, increasing the awareness of vaccines, vaccine-preventable diseases, and the benefits and risks of immunizations, using evidence-based science to enhance vaccine-preventable disease surveillance, the measurement of vaccine coverage and measurement of vaccine effectiveness, continuing these priorities to eliminate financial barriers for providers and consumers to facilitate access to routinely recommended vaccines. And we think the Affordable Care Act will cover most of this, but we'll be keeping a close eye on this. Creating an adequate and stable supply of routinely recommended vaccines and vaccines for public health preparedness. You've heard some of that this morning about the medical countermeasure activities. Increasing and improve the use of interoperable health information technology and electronic health records. Improve global surveillance for vaccine-preventable diseases, and strengthen global health information systems to monitor vaccine effectiveness, coverage, and safety, and supporting global introduction and availability of new and underutilized vaccines. There's plenty going on in each of these areas, but these are the large themes that incorporate many of the components of the plan, and these are the things we think we need to be accountable for and measuring our progress against. So as we go forward, as I've mentioned, that we're developing the implementation plan now, which is about measurable outcomes, defining specific actions, not only of the federal government, but recognizing where the non-federal stakeholders have a piece of this, and then identifying what our current strategies are and where there may be barriers going forward. That's the same thing as mentioned before. So let me go back to this comment about, or this priority about developing vaccine priorities. So it turns out that ends up, if you look at the plan, it is the first thing in the plan. And it's not prioritized within it, but it just happens to come out that way because it's under the research and development goal. But this is something that I hope that you're familiar with, at least in the past. There have been 2 previous efforts at this that the U.S. government supported the Institute of Medicine to look at. In the mid-'80s, there was a 2-part set that was about new vaccine development targets. The 2 parts were domestic and global targets. There was another version of this in the late 90s that was mostly looking at cost effectiveness. And developed a model or a tool for decision making. So we've asked the Institute of Medicine to take a hard look at this again, and have asked them to do this for both domestic and international targets. And it's not because we, the United States, or the National Vaccine Program Office think that we should dictate what vaccines are developed for everybody else, but we thought as long as they're going through this exercise, they should consider global needs as well. And we've done this in consultation with the World Health Organization. You've probably heard about the decade of vaccines, and there's an activity within the decade of vaccines that's really looking at the same elements. So now we've got this committee that's now started, and I think that this is, of the many things in the plan, that this may be the most interest to you to continue to follow this. They've had an initial meeting in March. Their next meeting is May 3rd, I believe, and you can find this on the Institute of Medicine's websites. But I think increasingly you'll want to follow this. You may be participating in it already, but I think they're going to want to hear about not only the kinds of diseases for which we should have vaccines as targets, but maybe the new opportunities where new technologies can improve the prevention of disease with new vaccines. So that's what's going on now. And again, the Institute of Medicine, you've probably had a chance to interact with them before. The committee meets lots behind closed doors where they can sort of roll up their sleeves and discuss things, but they also have regular public meetings. And the first one was really the introductory meeting. Some of you, I think, may have participated even by phone, but I would encourage you to pay attention to this one, given what your interests are, and that this is looking at new vaccine targets for the next decade. So that's what we've asked them to look at, and we've asked them to begin by thinking of the range of things they might want to consider. So not only the epidemiology and the disease threats and diseases that are not currently vaccine preventable, but as I mentioned, the opportunities now that technology may bring us to improve the prevention of diseases that can be vaccine preventable. So looking at the burden of illness and the cost, these ideas about scientific opportunities and platform technologies, so they need to hear from everybody. So if they haven't heard from you yet, now's your chance. I'd mentioned this, and I suspect that everybody has heard about this, and anybody who hasn't heard about this probably has an Apple because they don't pay attention to the Microsoft Bill Gates part of this. But I think that Bill Gates has done us a favor by having us focus on this. A year ago at Davos, he announced the decade of vaccines and the kind of things that can be achieved. The decades of vaccines, I don't know if you have a discussion about this in this meeting, and some of you may be parts of this in different ways, but there are a number of different areas that they're looking at. I'd mentioned about the research and development of trying to think of where there are opportunities that aren't otherwise ongoing to bring forward new vaccines or new technologies. There's a financing aspect of trying to think about how, once these vaccines are created, how they're going to be sustainably implemented. There is one that's looking at an area that's looking at global policies and a whole advocacy communication piece. So I think increasingly we'll be hearing more and more about the decade of vaccines, and I think similarly people are going to be asking the question as well, what's been achieved over the decade? So I'm proud to say that we had our national vaccine plan out there with this 10-year vision before this started, but it really coincides nicely, as I think there's going to be increasing focus on vaccines for all of these reasons and for all the reasons that Mr. Greenwood highlighted in his introductory remarks. One other piece, and we can talk about this maybe more in the panel, about the need for communications and the need for good information. Other parts of the government, and largely within HHS, there are these portals where you can find sort of one-stop shopping for vaccine information. And we've just put this up for vaccines.gov, which is threatened to go down Friday at midnight, like all these government websites, because it counts as work, I guess, if they have a website up. But I would encourage you to take a look at this. And it really is trying to be a clear pathway for getting information out. The initial round of this is really designed for parents to try to find the information they can otherwise they find is often cumbersome when they get 3 or 4 layers into another website. So hopefully with the usability testing, this is now a site that people will be able to find potential, and hopefully in preference to places where they might find information which isn't as much based in science that might have some implications for decision making. So I've mentioned about the National Vaccine Plan, the implementation plan, which is now going on. We're going to have, there'll be meetings around the country, there'll be meetings in Washington. These are not yet planned, but I think the idea is to hear from everyone about the development of these metrics of how we want to measure the plan and how aspirational we think we should be. There'll be regular reports to the National Vaccine Advisory Committee that meets 3 times a year. Those are public meetings, so you can come or you can dial into the web. And then we're planning to have a midterm review in 2015. So with that, I leave you. I'm interested in your comments about this. This is really what's going on in this tablet. It's the National Vaccine Plan. But I just want to go back and highlight, again, the broad spectrum of what the National Vaccine Program is all about. And this is supposed to be my job. So the idea about all those check marks and all those columns is to somehow keep it all together. As we've heard in some of the discussions, there's a lot of this that goes on already, but I think increasingly we recognize that this is not only across the federal government, there are a lot of different components, but more broadly, the non-federal sectors have to be a contributor as well. So I often think about, and maybe this is the way people think about government, is this way, and ideally, this is what happens. And so, and maybe that's why this is the little thing in gold, because it doesn't always turn out to be the gold standard. So thank you for your attention, and I look forward to your questions and comments.